The center was set up almost 30 years ago, which is when I came here, as part of a statewide network of occupational health clinics, and it's publicly funded for the most part. And the reason the network was set up was to plug what is a big hole and remains a big hole in the medical system. That is, occupational disease is what I would call a silent epidemic. People don't really know about it, pay attention to it, really haven't figured out how many people actually get sick each year or die each year from an occupational disease as opposed to an occupational injury.
Industrial hygiene is a study of the work environment, right? The conditions that may cause disease. And so working in this center, having a person like me is vitally important. It really helps to shed light on what the patient is experiencing at work, what are the things they're exposed to, and that helps the clinician understand what is really at play here, what is the causation of disease, right? And you need to understand that really to treat some diseases and also to prevent diseases. So really, I'm part of this multidisciplinary team that tries to unravel the mystery, the understanding of what causes disease in our patients.
What I do as a social worker here to support our workers is kind of a three-part thing. First, I do an assessment for them. Most often, 99% of our patients have depression. So I do therapy, counseling with them. Lots of times our clients are in financial stress, so I try to look for resources outside of the clinic to help them for financial stability through this tough period of time, and also guide them through the comp system as well as Social Security if that's an issue too. So whatever kind of problem set up, we kind of take it on. Each case is different.
The work I did was climbing communication towers, and I did that for over 10 years. It was a culmination of many injuries and an illness. It brought me here. I couldn't do my job anymore. My shoulders were both torn up, and my spine and neck, and I could no longer do my job. And when I showed up, it was like no other doctor visit I ever had. They did a full workup on me. I never had a doctor visit like that before.
The Low-Wage Worker Health Project is an initiative that's it's a collaboration really with community-based partners. We go out in the community, we connect with low-wage workers through agencies that already are serving them in some capacity. So we're able to reach them, reach workers and people in the community where they are. Workers are facing unstable wages, precarious schedules, and difficulty in their conditions on the job. So we first went out and surveyed and characterized their struggles, and then we moved into an education and empowerment phase of the project, which we are using innovative methods for people. So we are learning about workers and their problems. At the same time, we're helping them to know more about their symptoms and how they connect to the exposures they may be facing. So we're connecting their thinking process so where they can see their workplace in a new way.
We are very lucky to be in partnership with the Occupational Health Clinical Center. They have an approach that is not only to care about the body and to think about how people are getting sick because of their job, but also to go further than that and also do education and outreach, and that's something that we work together.
The steelworkers have been at the forefront of fighting for worker health and safety for over 70 years. When it comes to occupational disease, many employers try to defend themselves and argue that any onset of illness by their workers was caused by general environmental concerns, had nothing to do with exposures at work. And unfortunately, in the medical community, even today, 30 years later, very little time is spent in the curriculum for positions on occupational disease.
I think that we will, strive to continue doing what we've been doing for our individual patients, but in addition to that, I think the efforts around prevention, particularly around reaching low-wage workers, is going to be crucial to our efforts and our activities in the future. Workers are central to preventing occupational disease, and that power in the workplace is a fundamental sort of underlying issue that is not necessarily talked about, but is sort of the gorilla in the room, in the sense that if workers or if conditions are going to change at work, which is what's necessary if you're going to prevent occupational disease, then how are those conditions going to change? And workers historically have been at the heart of changing workplace conditions, and our sort of approach is to help workers have the tools to facilitate their empowerment to do just that.